Have you heard about the Global AIDS Strategy 2021-2026, End Inequalities, End AIDS? This strategy lays out a framework for transformative action to reduce these inequalities by 2025 and to get every country and every community on track to end AIDS by 2030. To achieve this, the strategy has a bold new approach to use the inequalities lenses to close the gaps preventing progress towards ending AIDS while prioritizing people who are not yet accessing life-saving HIV services. The strategy sets out evidence-based priority actions and bold targets. It demands that the HIV response be fully resourced and implemented with urgency and optimal efficiency to ensure everyone has access to life-saving HIV services. It builds on three interlinked strategic priorities: maximizing equitable and equal access to HIV services and solutions, breaking down barriers to achieving HIV outcomes, and fully resourcing and sustaining efficient HIV responses and integrating them into systems for health, social protection, humanitarian settings, and pandemic responses. Priority actions across 10 result areas and 5 cross-cutting issues are proposed to accelerate progress towards realizing the vision of zero new infections, zero discrimination, and zero AIDS-related deaths. We have also set ambitious targets and commitments for 2025 to end inequalities by placing people living with HIV and communities at risk at the center of the HIV response. These targets are, on the one hand, the so-called social enablers, that less than 10% of people living with HIV and key populations experience social stigma and discrimination. That less than 10% of people living with HIV, women and girls, and key populations experience inequalities and gender-based violence. That less than 10% of countries have punitive laws and policies. On the other hand, HIV services targets 95% of people at risk of HIV infection using combination prevention, the 95-95-95 scheme in adults and children, 95% of people living with HIV diagnosed, 95% of those who know their status on treatment, and 95% of those on treatment with a suppressed viral load. Also, 95% of women with access to sexual and reproductive health services. 95% coverage of services to eliminate new HIV infections in children and to keep their mothers alive. 90% of people living with HIV are on preventive treatment for tuberculosis, and 90% of people living with HIV and those at risk of infection are linked to other integrated health services. Finally, community empowerment commitments. So community-led responses to HIV are fully recognized, empowered, resourced, and integrated for a transformative and inclusive approach. These are the 30-80-60 targets, through which it is sought that community-based organizations will be able, by 2025, to carry out 30% of testing and treatment services, 80% of service delivery for HIV prevention programs for key populations and women, 60% of the programs supporting the achievement of societal enablers to be delivered by community-led organizations, including programs to eliminate HIV-related stigma and discrimination and gender-based violence. Ending inequalities is ending AIDS.